Welcome back to the show, Dr. Adalja. I first started talking to you during the pandemic and talked to you many, many times in those months and turned into years. And now here we are 6 years out, and we're still having, I guess, a debate or whatever you want to call it about the origins of the pandemic, among other things. What purpose does it serve in your mind? Are there questions legitimately that we still should want answered?
I do think that there are legitimate questions about the early days of COVID. What was going on at the wet market? What was going on at Wuhan Institute of Virology? But I don't think that this type of a hearing is the setting where you're actually going to get a very sober, objective judgment or probative type of consideration of those questions. I think this was more political grandstanding, and those questions went unanswered. And for those of us who tuned in wanting to get answers to learn about this, there was no education there.
What does the scientific evidence that you've looked over tell you about those origin questions that still are not completely answered? I want to go to Dr. Fauci's diary for a moment. It's on our telestrator that has, gotten so much attention here and did so ahead of this hearing released by Senator Paul, deliberately released by a crazy person in the lab in the Fauci diary. I'm not going to read this whole excerpt, but I'll start kind of right in here. They bring up the possibility that this could have been deliberately inserted, either accidentally released or deliberately released by a quote-unquote crazy person in the lab, the former being the most likely. Fauci writes, here's Senator Paul today at the hearing on the Wuhan research. Listen.
The American people would like to understand your reasoning, your rationale for why you chose to fund the research in Wuhan. There have been, intelligence agencies, the CIA, the FBI, the DOE, have all come to the conclusion that more likely than not, the virus came from the lab in Wuhan. How did you come to the conclusion that a totalitarian country would be capable of doing this in a BSL-2 lab, a lab that lacked the security?
I noticed the phrase that Senator Paul uses is more likely than not. What about your own research that you've probably looked over so many times from others? What do you think?
I don't think that it's easy to come to any conclusion because the Chinese government has had a massive lack of transparency. The Chinese government doesn't say that it came from the wet market. They don't say it came from the Wuhan Institute of Virology. I think that there is evidence that can support either of those hypotheses, but it's clear that the Wuhan Institute of Virology was doing things at a lower than expected biosafety level, and lab accidents do occur. And it's also true that in Wuhan, that the wet market had multiple animals that could possibly harbor this virus there as well. So I don't know that we ever get to the full bottom of this unless we get some information from the Chinese government.
And one of the challenges that presents, or one of the problems that creates, is that, we have so much disagreement, we have so much polarization on this particular issue in this country, and then if we get hit with something else, or even now as we try to get people to buy in to vaccines, for example, I wonder what the effect of all of that is. It came up with Senator Maggie Hassan, who's a Democrat of New Hampshire, saying this at the hearing earlier today.
Since President Trump took office in 2025, more than 4,500 cases of measles have been reported. Children are dying because there has been increased vaccine hesitancy, fueled by Robert F. Kennedy Jr., the Secretary of Health and Human Services, and frankly, his entire administration.
The senator's talking about Secretary Kennedy, who's had a long history in terms of his opinions on vaccines. What about the effect of all these arguments that we're having over COVID on something like this measles outbreak? What do you think?
I do think that all of infectious disease has now become very tribalistic, that there's a Republican way to think about it and a Democratic way to think about it. And I think COVID had that cascading impact because it really put people into two different camps. And now it's kind of metastasize out of COVID into every infectious disease that we think about, whether that's measles, whether that's hantavirus, whether that's pertussis. It's now kind of the new normal when it comes to infectious disease, that it's just one more thing that people fight about and have two different camps for. And that's not how you control an infectious disease. And you could also say that RFK Jr.'s rise to power was because of COVID, because of people's being upset about how COVID was handled, that his groups basically seized that opportunity and catapulted him into this position.
I've always found that back then until now that you're always reasonable and measured and research-based, so that's why I enjoyed talking to you then. We're all trying to figure it out, and I appreciate you coming on still now. Thanks, Doctor.
Thanks.
Dr. Amesh Adalja, Johns Hopkins.